When we look at the research to actually see that Parkinson's was arrested dead in its tracks is a pretty breathtaking result. And now we're seeing, slowing of decline in Alzheimer's patients, and even in diabetic patients, a 70% risk reduction in risk of developing Alzheimer's, in that case, in established diabetic patients, in the comparison part of that study to the use of insulin. We're hearing a lot about the ketogenic diet lately, that's for sure, and with good reason. There is so much to be gained by looking at this science and, in fact, engaging our bodies in a diet that lowers our intake of simple carbohydrates and actually welcomes back the consumption of dietary fat. And who better to tell us about the benefits of a ketogenic diet and his research than Dr. Dominic D'Agostino? We've had him on the program before. Let me tell you a little bit more about Dr. D'Agostino. Dominic D'Agostino is a PhD, and he is a tenured associate professor at the University of South Florida, Morsani College of Medicine, in the Department of Molecular Pharmacology and Physiology. He teaches medical neuroscience, medical physiology, nutrition, and neuropharmacology, and he is also a senior visiting research scientist at the Institute for Human and Machine Cognition to assist with their efforts towards optimizing the safety, health, and resilience of the warfighter and astronaut. His primary research focuses on developing and testing nutritional and metabolic-based therapies for a variety of disease states and advancing the use of metabolic-based therapies into human clinical applications. So I'm really looking forward to our time together with Dr. D'Agostino. I've known him for many, many years. He's really a leading voice in how we understand things like the ketogenic diet, how we regulate our blood sugar, and how we can really increase insulin sensitivity, which is a very important goal. Let's get right to our interview. Dominic, how are you doing?
I'm doing very well. Great to be here.
Yeah, it's good to see you again. There's a lot of talk about ketogenic diet. People are wondering what it's all about, why it's important, and we're going to unpack that. That's for sure. And you're the man to do it, or the person to do it. But how'd you get started? What made you so interested in metabolism?
Yeah. Well, I've always been interested in nutrition, and I did major in that as an undergrad, along with biology. And then I was mentored by a physiologist and a neuroscientist. So I did my PhD in both of those things. And I just knew, fundamentally, I did my PhD in a pulmonary critical care division. And many of the people, even in there, were many of these treatments, could have been a nutritional intervention for that. And I did my postdoctoral fellowship mostly focusing on drugs that could mitigate seizures, oxygen toxicity seizures, which limit Navy SEAL diving, and hyperbaric oxygen therapy. So our lab we have a hyperbaric research center at the lab. So I do a lot of work on that front. And then, we were using drugs that essentially were not working to block the seizures. And then I discovered that, the ketogenic diet had been used for, since the 1920s. I transitioned into that, and really that changed the trajectory of my career, as did your books. Soon, about 4 years into this, you had published Grain Brain, and then Brain Maker, Brainwash, and then more recently Drop Acid. So your books have really sort of provided me with the fundamental principles and sort of reinforced a lot what I was doing at the medical college. And I was in a tenure track position, so it was not really looked favorably transitioning from drug research to nutrition research. And but it all worked out. So
Yeah, how does nutritional research benefit the institution per se, right?
yeah, that's a question. Yeah, so there's not a whole lot of
It's
NIH
just a question. We can
funding
leave that
for
one
nutrition.
hanging in the air.
Yeah.
So, ketogenic diet, and you've become kind of the godfather of the ketogenic diet, the go-to guy to really break it down, explain it to people. I mean, there's certainly plenty of influencers talking about
Mhm.
aspects of ketones and various diets, time restricted eating, actual full on fasting. But what is it about being more into ketosis? And maybe we should first talk about what that means. But what I want to do is ultimately get to the place that that seems to be a good thing for metabolism. Then we'll look at why improving our metabolism is a good thing and maybe relate that to the brain. Why not? But let's just first talk about what it is that you're trying to do. Why are you trying to increase ketones and what are they? And why are you trying to increase them in the bloodstream?
Yeah. Well, there's even a debate within the epilepsy world as in regards to the levels of ketones and their, you know, how they correlate to seizure control. And now I think the data is emerging that if we look at beta-hydroxybutyrate and acetoacetate and also acetone, which these are all things that we measured like with mass spec in the lab in our early studies, we find that the degree of ketosis is there's good evidence to suggest that that's associated with the therapeutic efficacy of this nutritional intervention. And the ketogenic diet being a very calculated macronutrient ratio that shifts your physiology from burning primarily glucose for energy to fatty acids and ketone bodies for energy. And then the ketones more or less become the alternative energy substrate. In addition to glucose, we're still burning glucose for fuel, but then they become an alternative energy substrate that not only have metabolic effects, but they have a wide range of signaling effects. And they're being used for, at least 24 different clinical applications. And I know them off the top of my head. I can kind of run through them all and why. And, 10 years ago, there might have been three or four, like, Lennox-Gastaut syndrome or Dravet and, different forms of epilepsy. But there's 439 registered clinical trials on clinicaltrials.gov right now for ketogenic diets. And actually, that dropped very slightly from last year, which was like
Hmm.
450 or something, mostly because there's about 100 or more clinical trials on ketone supplementation. So many people, that are coming to this field kind of see that an innovative path of using various forms of ketone supplementation for some of the same disorders.
So actually, exogenous ketones that are ingested, and I'm wondering if there may be less interest in studying a dietary intervention that targets metabolism in our current climate, in that now we're seeing such an overwhelming representation in the research and certainly in the clinical application of GLP-1 agonist drugs.
Yeah, I mean, I think that's kind of like a good example, right? Our medical college has a nutrition science course, and we're one of the maybe less than 20% of medical schools that have a nutrition program, and within the various speakers, there's quite a heavy interest, I would say, on GLP ones,
Mhm.
but also like nutrition with GLP-1s, but also the off ramp to coming off of GLP-1s and how
Yeah,
you
always
manage
a challenge.
nutrition with that. But GLP-1s they're amazing drugs. My course director, Dr. Barbara Hansen, has worked with Gerald Schulman. She's spearheaded the original insulin research, and diabetes. And she did the original research in GLP-1s all the way back in the 1980s and 1990s. I think maybe people don't even know this research was going on back then. But she was involved in that research, and they have remarkable effects on metabolism, primarily through dietary energy restriction, right? So the gastroparalysis, and they do come with a host of side effects. I think in some cases they can be even life saving for that, obese type 2 diabetic and really add years to their lives. But I think they need to be used cautiously. And I think,
Yeah, it's really sweeping through like wildfire.
yeah,
It's an
for sure.
interesting metaphor. I would choose that in these times, but nonetheless, in our world, your world, and my world, related to the brain, I think we're really starting to see some. And I'm not arguing in favor of widespread usage of GLP-1 off agonists off label for brain issues, but
Yeah.
when we look at the research that the New England Journal of Medicine article from April of last year demonstrating
Mhm.
in a one-year interventional trial of, I think, 153 Parkinson's patients, that the placebo group declined on the UPDRS scale by about 3.5 points, as expected. But the intervention group getting lixisenatide not only stabilized, but had a slight improvement. You and I have never seen that. I mean,
No.
we've seen slowing down of the decline on a ketogenic diet. Matthew Phillips' work in
Yep.
New Zealand has
Yep.
demonstrated that. But to actually see that Parkinson's was arrested dead in its tracks, that was a pretty breathtaking result. And now we're seeing, slowing of decline in Alzheimer's patients, and even in diabetic patients, a 70% risk reduction
Yep.
in risk of developing Alzheimer's, in that case, in established diabetic patients, in the comparison part of that study to the use of insulin. So, I bring these points up because it keeps you and me, keeps you and me
Mhm.
focused
Mhm.
on the pivotal role of metabolism, and your work in dietary intervention as it relates to metabolism and gets us back to ketogenic diet. So let's just, for a moment, unpack the notion of ketogenic diet, the production of ketones, versus pretty much the higher carb approach of the modern day, what used to be called the standard American diet, then the Western diet, now the global diet, where we're pretty much running on glucose day in and day out. How does metabolism look different when people are more ketogenic, i.e., cutting way back on the provision of carbohydrates and actually welcoming a diet that brings some fat to the table?
Mhm. Yeah, I think it's important to recognize that the ketogenic diet is a pretty restrictive, and some may say severe, some may say draconian dietary approach that restricts carbs typically under, in kids, it's under 10, but in adults, under 20 grams of carbohydrates per day, no sugar, no added sugar, no starch, maybe small amount of fiber you would get from green vegetables. So with the balance of the macronutrient energy coming from fats. So with a classical ketogenic diet, it's about 87% fat. With a modified ketogenic diet, upwards of about 65% fat. And then there's different categories of ketogenic diets, from classical to modified Atkins, the MCT based diet. There's a low glycemic index diet developed by Elizabeth Teal from Harvard, so which is not ketogenic but may have some therapeutic effects, like for autism and other disorders. But the primary thing is that you're suppressing the hormone insulin, and a suppression of the hormone insulin is required for hepatic ketogenesis, for your body to make ketones. And essentially what happens is that with carbohydrate restriction and protein moderation, there's a depletion, a decrease in hepatic glycogen. And the liver is more or less like an energy sensor. And when levels get low enough, that stimulates beta oxidation of fatty acids in the liver, and then the accumulation of acetyl CoA will that'll form acetoacetate, and then that makes beta hydroxybutyrate, which is the more stable ketone molecule in circulation. And we have different ratios of acetoacid to beta hydroxybutyrate in the blood, and it's sort of an interesting area of science and research to sort of look at that. But the definition, the clinical, is that your elevation of blood ketones is about 0.5 millimolar and above. But we can measure ketones in urine, in blood, and also in breath. And I've experimented with all these different measurement tools, many of them commercially available. And when you achieve and sustain that, we know that ketones are neuroprotective, they're cardioprotective, they're anti-catabolic. We've published on cancer cachexia. We have models where we inject lipopolysaccharide, LPS, and create massive systemic inflammation, that we can mitigate a lot of that with elevating ketone levels. They have antioxidant effects, they have anti-cancer effects. So we researched these, and we've published multiple dozens of publications, like on all these different applications.
So there are a lot of popular diets now: time restricted eating, full on ketosis. Dr. Walter Longo talks about fasting mimicking diet.
Mhm.
And are these all kind of nuances of allowing the body to be trending more, at least directionally, towards more ketosis?
I think that's one of the benefits. With time restricted eating, intermittent fasting, time restricted feeding, whatever you want to call it. Essentially, what's happening is that you are creating an eating window and a fasting window, and during the fasting window, you are putting your body into typically a mild state of ketosis. You're reducing the level of insulin to levels that would otherwise not happen. Maybe if you are even calorically restricting the same. amount, at least during that window. So the benefits from them are derived largely from the energy deficit. I would say like maybe 80%. It's hard to put a number, but then there are probably additional benefits. For example, you're letting the gut rest and repair. You're enhancing maybe enhancing gut permeability or reducing gut permeability by giving your gut some time to rest. So I think there are some additional, benefits by having that fasting window independent of calories. And that seems to be the debate within people in the field that study time restricted feeding. And other people looking at energy models will say, well, all those benefits can just be, tied to the caloric deficit, that you inadvertently eat less food if you're eating within a restricted window. And I think that's true too, but I think there are some additional benefits, as Dr. Walter Longo, Dr. Sachin Panda, have talked about. I've interviewed them for various podcasts too. So
The work is breathtaking, and
mhm,
when you take a deep breath and step back, it seems true that what we are doing is emulating our hunter-gatherer forebears, who must have had times when their hunting and gathering was not as productive, and they had to be a bit more resilient. And I think that what you're really presenting here is a hormetic stress, that
mhm,
when we are calorie deprived, energy deprived, that it is a bit of a stress. And what we're then taking advantage of and activating are these mechanisms whereby we ultimately become more resilient and stronger metabolically, by stressing our bodies in this way, by restricting the carbs and allowing our bodies to utilize our endogenous fat, or, as is popular today, providing exogenous fat in the form of supplementation.
I think there's also all great points that you make, and I also think there's probably a behavioral component when you do that, that it changes your relationship with food, and that maybe it instills in you a level of discipline around food, around
Good point.
restriction. And the more you do it, the easier it gets, and I think the more benefits you derive from it. So it's kind of like a feed forward sort of thing, is that once you start to experience the energy and quite frankly the dietary control that you have once your insulin is suppressed and you start making ketones. So the ketones do, I talked about, we study the neuroinflammation, we study anti-cardiac, anti-cancer effects and things like that. But I think just by virtue of being an energy molecule that your body has access to, it keeps your brain in a state of preserved metabolic energy production, even in the face of hypoglycemia, which is associated with a caloric deficit. So I think achieving and maintaining a level of ketosis makes being in a caloric deficit more easier. So you don't, the hypoglycemic lows do not trigger a craving for food and overeating and going off the rails. And the early work by George Cahill and Oliver Owen at Harvard, when they fasted subjects for 40 days and injected them with insulin, they were asymptomatic for hypoglycemia, which was in 1967. They published that. It was just a very dramatic demonstration that ketones could largely replace glucose as an energy molecule. And so that's, the neuroprotective component to that really interested me. But I think more practically, if you have low levels of ketones, even 1 millimolar is providing your brain with 10% of its available energy, just one. So pretty much, I remember talking to Dr. Cahill and Dr. Veach about this, and it was like, one millimolar was like 10% of brain energy, 2 millimolar is like 20% of brain energy, largely speaking. So that's very important in the context of many disease processes.
Well, I think it's interesting from that research that, even at the 40-day point with those subjects, actually they were medical students, and
Mhm.
I think perhaps some pre-med students who got paid for this.
Yeah.
That even at that point there was still utilization of about 20% of what was powering the brain was still glucose. I mean, we have a
Mhm.
notion that, well, you're shifting over to full on ketones, and the reality is there's still residual glucose powering the brain. I thought that was quite interesting.
Yeah.
So
That's important because that gets confused a lot. Like if
that's
you go
right.
on a keto, your body, it's often framed like you switch from glucose to ketones, but there's a transition more, but there's very powerful homeostatic mechanisms that maintain our blood glucose. And that the ketones can fill that energetic gap. But even when you fast for a week, which I've done, my glucose still stayed at about 60 millimolar or 60
And
milligrams per
no one's
deciliter.
gonna
Yeah,
say that fasting is easy. It is a
yeah,
challenge. I mean, we've all done it. We've all tried to walk the talk, and
sure.
to be fair, it isn't easy. But being on a more ketogenic diet is certainly a lot easier, and
Hmm.
especially if you cycle. I don't mean bike. I mean if you if you
Yeah.
cycle between keto, being in keto, and not being in keto. And you mentioned, are you using? What would a consumer you think use to measure his or her depth of ketosis? Do you think the breath analysis is adequate?
Yeah, I have lots of things right around my
I'm
desk because
sure
I'm
you
doing
do.
experiments now. So you have I don't market any brand but the Abbott Precision Extra. I mean, we've published a lot with that. The more recent is the Keto Mojo device that has the glucose ketone index that we can go into that. That's the millimolar concentration of glucose over ketones. It's a very important biomarker. I got lots of tools here. Lactate meter. I got your. You are sure the uric acid.
You were
Thank you
sure.
for sending that. I'm still measure that. And then
Mine's
there's
here
breath ketones
somewhere.
too.
Yeah, I keep mine handy. Actually, I correlated my Urasure to a blood test, and I got the results yesterday, and it looks like it's right on target. Yeah, I got
Yep.
4.6 at the lab and 4.7 on the finger stick. So
I did. Yeah, I got 4.6. I don't know if you could see it from
there
there.
you
Yeah.
go. Great minds think alike.
Yeah. Yep. Yep. And that was sort of after a meal too. So yeah, I also validated mine with Quest Diagnostic Labs, and it was like plus or minus zero point 0.2 or zero point 0.3. So it was pretty close.
There you go.
Yep.
You mentioned how ketosis is really a good way of restoration for insulin sensitivity by reducing insulin, reducing the challenge of higher levels of insulin in the body, and good for insulin sensitivity. Why should we care?
Mhm. Well, broadly speaking, most Americans are insulin resistant, and after, especially after 50 in the 60s and 70s, pre-diabetes or people have overt diabetes. It's a large percentage of the population. So the fastest way to bring down your insulin and to restore insulin sensitivity is to restrict carbohydrates and to restrict, to some extent, total calories too can help augment that process. But fasting, time restricted feeding combined with a lower carb, I like to do time restricted feeding with a ketogenic diet, but you could do with a Mediterranean pattern. I like to use the word low carb Mediterranean style diet. I'm still confused about what a Mediterranean diet is and how it's defined in the literature. But simply eating 100, 50 to 100 grams of fibrous carbs per day, and following a Mediterranean style diet would probably, restore most people's health. We
Mm.
tend to target like disease processes and, everything from genetic disorders to epilepsy to other things. And then a bigger lever for that would be ketogenic therapy in the form of diet or supplementation or, maybe even time restricted feeding. So, but it's that insulin. It all kind of focuses. Just to get back to your question, reducing the level of insulin and restoring insulin sensitivity through
Mhm.
carbohydrate restriction.
Well, hi everyone, Dr. David Promoter here. We hope you're enjoying this content, and if you would do so, go ahead and hit the like button. And if you're not already a subscriber to our channel, please consider doing so. We're really grateful to have you as part of our community, so let's get right back to the presentation. I think a question that a lot of people have is on how much protein they should be consuming. And you
Mhm.
indicated earlier that if you're consuming a lot of protein, that might help keep you out of ketosis, which is not the goal. We're hearing the protein recommendations kind of across the board. Some people are saying as much as 1.5 grams per kilogram ideal body weight. It seems like a lot. Others zero
Mhm.
point 0.8 grams per kilogram ideal body weight. So, through the lens of trying to maintain some degree of ketosis, how much protein do you think is best for an individual who's not necessarily trying to accomplish anything in terms of disease reversal, but just for maintaining good health?
Yeah. Everybody will have different protein requirements based upon, their level of muscle mass or activity level and things like that. And I know Dr. Walter Longo kind of advocates for a lower protein approach. We've had
Correct.
that conversation before. But I kind of point to the research by, Donald Lehman and Stu Phillips, where, say let's do grams per pound, upwards of 1 gram per pound of protein. I think, especially as we age, we have age-related sarcopenia that we want to mitigate, and
That means
what?
loss of muscle mass
Yeah,
for our viewers. Go ahead.
yep. This may sound very extreme, but even 1 to 2 grams per pound may be helpful. For some people, if you're in a caloric deficit, then the proportion of protein in your diet, the ratio would be higher. I think, because you want to mitigate some of the muscle loss that can accompany weight loss. So obviously, we don't talk about exercise enough. If exercise was in a pill, it would be blockbuster. It would be more effective than anything we currently have available.
Or sleep
But
in a pill.
or sleep, yeah, sleep is like super important too. Good sleep hygiene and light and yeah, just the balance of those things. So, but if your protein requirements will increase with resistance training, with exercise to help, rebuild. And so I'm of the opinion that if we do the metric scale, about, 1.6 to even 2 grams per kilogram
Of ideal body
is
weight.
important. Yes, of ideal body weight. Yeah, important to say ideal body weight.
Well,
Mhm.
to be fair, that's kind of on the higher side, correct?
Yep.
In
Yeah,
comparison
yeah.
to what others are saying. Plenty of people are right there with you. But then again, does that tend to help steer us away from our ability to engage ketosis?
It can, yeah. So this is like clinically for kids. Part of one of the side effects, I guess, most serious would be, well, there's kidney stones, and then we figured out if you do potassium citrate, you can there's no higher risk of kidney stones. But then early studies show a bit of a stunting of growth, growth metrics were a little bit reduced, and
Hmm.
some of the early studies with clinical classical ketogenic diets were limited. And if you have children need higher protein, and we were in ketogenic diet studies for epilepsy, the protein was restricted to increase ketones more and to control seizures. So we know now that a modified higher protein ketogenic diet can have the same anti-seizure effect, especially if that diet is formulated with specific types of the early fats were like Crisco and hydrogenated oils. These were in like shakes that kids would drink. But now we know a lot more, monounsaturated fats, but also medium chain triglyceride or MCT oil can be incorporated into the diet, and you can get levels of ketones that are even above a 4-to-1 classical ketogenic diet with a 1.5-to-1, which essentially means, getting about 20% of, the calories from protein. And the early diets were like 8%. And that was too low. And that created side effects and growth.
Do you think their growth issues might have been just from an overall reduction of protein, or could there have been a more specific targeting that might have obviated it by adding in higher levels of branched chain amino acids,
Yeah, I mean, typically, like, these are formulated with like a casein or whey, and they
which are
have
pretty
high
complete?
amounts of EAAs and branched chain amino
Yeah.
acids, with the leucine content being the primary driver for skeletal muscle protein synthesis. So that it was probably sufficient, but you still need, an increase in the total amount of protein. And, with that level of protein restriction, you're probably not getting to that leucine threshold for, stimulating protein synthesis. So
Hmm.
I think essential amino acids can be really important for maybe women or other people that don't like to eat as much protein, and that if you're doing more of a plant-based approach, you know, EAAs or essential amino acids and branched chain amino acids could be added to a meal that's, for example, more plant centric or plant based approach. And I think that's usually the only time that I would advocate for that, because like an egg, even if you're a lacto ovo vegetarian or something, or just get a little bit of dairy, you can do okay. But if you're vegan or vegetarian, I've worked with different registered dietitians to formulate those meal plans. That's where we go to essential amino acids or branched
Hmm.
chain.
In that, inflammation seems to be such a central player in the degenerative conditions, and certainly let's just go neurodegenerative conditions.
Mhm.
What is the mechanism whereby we are reducing inflammation by getting more of a ketogenic program going?
Yeah, I think it's multiple mechanisms working in synergy, right? So a ketogenic diet is by its nature a restrictive diet, so it's probably restricting things like grain and
Mm,
maybe certain types of fiber and helping to change the microbiome in a way that probably enhances gut, the tight junctions and reduces gut permeability. So there's that going on. And
good point.
whenever, yeah, initially though, kind of what you may see, we see this in rodent models and also in humans. Sometimes the stress of the initiation of a ketogenic diet could make certain biomarkers jump up, like HSCR, and then it comes back down, it plateaus and be lower than baseline if you stick, into a state of nutritional ketosis. But you have many things going on at the level of the gut, at the level of glucose coming down, insulin coming down, ketones going up, and everything I just sort of mentioned. With a properly formulated ketogenic diet that does have fiber in it, and I think I'm a proponent of a higher fiber keto, like 20 to 30 grams of fiber. I feel should be important, and we could talk
Mm.
about the different types of fiber, but
Yeah,
also,
it's a great point though, that
yeah.
people who are eliminating carbs, and fiber is by definition a carb, uh, that's a risk. That's something that I think is really part of
Mhm.
the induction education, that, hey, yeah, it's a carb, but you're desperately in need of fiber.
Yeah, and some people do thrive on a carnivore diet, and I get quite a few people will email me, and they're
I
essentially
bet.
eating, and I think fiber is not, to my knowledge, not essential, but and most of the data people point to is epidemiological data, but it's really good data. It's good epidemic, and there's a number of studies showing that prebiotic fiber can enhance butyrate and really help to restore gut health. Fermented foods, in some cases, maybe probiotics are helpful, but I think certain types of fiber, I think, are important for most people
I
in a
can't let
ketogenic
this
diet.
go. I mean, this is really very interesting. The messaging has been, well, we need to eat a lot of fibrous vegetables on our plate, various colors for the polyphenols, on and on. And yet, what you just said is really quite interesting. That people who are full on carnivore, uh, at
Mhm.
times tend to, when you metricize them, they're in pretty good shape. Obviously their microbiomes are quite different, but when we look at, for
Mhm.
example, the Inuit, who have very little plant fiber in their diets, and yet, are existing on ocean type protein and certainly fat. And that's, for many months of the year, that's the mainstay of their diet, and yet seem to be pretty resistant, at least to cardiovascular disease. Maybe that's the offset by the omega 3s, who knows? But,
Mhm.
this is I think, an area that needs further unpacking, or at least exploration.
Yeah, it's not being studied rigorously right now. I think Dr. Belinda Lennertz might be looking, like tracking a number of carnivore, uh, followers, and she's published something out of Harvard to just sort of more of an retrospective observational study looking at the different biomarkers. And I've, at least maybe a half dozen people will, have emailed me with longitudinally, like sending me their blood work. And I would basically say, I think anybody
I'm
would
gonna
say,
send you my
keep
blood
doing
work
what you're
too.
doing. Yeah. Yeah. The LDL is elevated often in people, but with other, insulin, HSCRP, hemoglobin A1C, triglycerides, even B12 status is up, but that ApoB does elevate, HDL, ApoA1 too will go up, and that's a good thing. But you see this elevation of ApoB, or yeah, LDL cholesterol. And should we be concerned about that? I think that's an area of ongoing debate and research.
Well, I
But
think it's a question of how, as well, the personalized medicine approach. How much can that individual
yeah.
tolerate? I know for me, I cannot tolerate any further elevation of LDL. So,
Hmm.
but so I guess that's where the personalized medicine comes
Yeah.
into play, and certainly genomics as well would factor into that.
Yeah, yeah. There's a, I was at a conference and I said I thought genomics was, genetic testing was important for cardiovascular health, and that was quite debated with me on that. But personally, I did a GB Health Watch. I don't advocate for any specific testing, company or anything, but it did. And someone said, I think you are a hyper responder of cholesterol, just based upon what I've seen in your dietary patterns. And this is someone that looks at thousands of patients. So I have a mutation for the MPC1L1 transporter. So that's the transporter in the gut. So, and Zetia, also generic name ezetimibe, blocks that. And I could take a baby dose of that and it literally cut my ApoB like in half and trended to increase my HDL. And my triglycerides went down a little bit too. And I didn't change anything. So that was, I'm not in favor for my situation for taking a statin, but ezetimibe monotherapy, 5 to 10 milligrams per day, had a remarkable effect on me. And I don't know if, other people have told me that. And I said, well, you should go get tested to maybe see if you, but I think, there's a lot of different drugs. We have very good drugs for lipid lowering. And I think they should be considered for people that have a history, or maybe if they have ApoA is elevated, like Apo little a.
And really on the basis of their cardiac workup as well. I mean, what is their
Yeah,
calcification score?
that's the big one.
What
Yep.
is their CT angio looking like? And
Hmm.
these are very valuable. But I would also think it's important to rein them in metabolically as it relates to insulin and glucose as well.
Yeah, I think we have to look at it more, get the whole picture, and I think having a calcium scan and a CT angiogram or something like that is really important, especially if you have a family history of obviously have had a heart attack or something like that.
Yeah.
Um, but yeah, I think we need to be cautious at this point in time, when it comes to carnivore diets and that, because I get a lot of questions,
I
about.
completely agree. I would add to the data set that looking at epigenetic expression or
Mhm.
tags, very important. I just did a test called True Diagnostic, and it's very helpful in terms of indicating where you are epigenetically in terms of risk moving forward. And the good news is, to some degree, you can change your epigenetic expression based upon lifestyle intervention. But I would, clearly based upon
Mhm.
pharmaceutical intervention as well. Let me get back to the notion of ketogenic diet and its role in insulin sensitivity and its role in glucose metabolism. Can we just momentarily touch on GLUT1 and GLUT4 transporters and how that's influenced, what they do, and how that's influenced
Mhm.
in the presence of a ketogenic diet?
Yeah, let's start with GLUT1. And we actually have the glucose transporter type 1 deficiency mouse, mouse model.
Wow.
And that is, I don't know, but maybe your listeners don't know, but the standard of care for a deficiency in GLUT1 is the ketogenic diet. So that is like this, literally the standard of care for that rare inborn error of metabolism. So the GLUT1 is, it's in the blood brain barrier, and it helps to transport glucose, into the brain. And it's on a wide variety of different tissues, even in cancer tissues. We're developing drugs to potentially target that. So GLUT1 is not insulin sort of activated, whereas the GLUT4 transporter can be translocated. Probably has its most profound role on skeletal muscle and activity, resistance training, cardiovascular, stretching the muscle, and an increase in insulin and different things can translocate that receptor to the muscle and make it can enhance glucose disposal, and that can be done sort of independent of insulin too. That there's like a insulin independent translocation of the GLUT4 that's sort of an activity dependent thing. So if you're like a type 1 diabetic and you eat a carby meal and then go exercise, some can even like inject way less insulin or no insulin at all because that response is so powerful.
You had also mentioned that there's some signaling activity associated with the production of ketone bodies, specifically beta
Mhm.
hydroxybutyrate. I think it kind of gets to our brief discussion on epigenetics. What are some of the important signaling aspects of this ketone beta hydroxybutyrate that we increase as we're in more of a ketogenic diet?
Mhm. Yeah, that's really like the hub, the main focus of the lab, and it started over 10 years ago. We looked at just looking at the brain, the neuropharmacology of the brain changes with the ketogenic diet and with exogenous ketones. So it increases the GABA to glutamate ratio by activating GAD65 and 67, are proteins that our glutamic acid decarboxylase will convert glutamate to GABA. So there's, the brain neuropharmacology. We published a paper in 2015, and I helped formulate the diet in Nature Medicine that showed the beta hydroxybutyrate uh, can function as an NLRP3 inflammasome suppression, actually. And then if we look more into it, the activation of the complex, the inflammasome, and the assembly and the activation, both processes are regulated in part by beta hydroxybutyrate, and that can reduce and suppress that, and downstream that would reduce IL-1 beta. So we looked at IL, and it's independent of the enantiomer. Your body makes primarily D beta hydroxybutyrate, but also makes L beta hydroxybutyrate as a mirror image in an enantiomer. And what's interesting about L, and now there's a bunch of people patented it. I think the Buck Institute and there's a number of different patents on the L, but that simply sold as racemic. You have a 50-50 mixture. The L seems to retain that signaling property. And if you consume a racemic mixture, the D gets burned up quickly as energy, and then that L stays elevated in the blood about 4 times longer, and then retains that signaling effect. So there's a GPR109A receptor, the NLRP3 inflammasome, and different sirtuins that too are sort of activated, and that's epigenetic. And then my student just graduated about a month ago with her PhD dissertation. Her focus was metabolic control of epigenetic regulation. So there's something called beta hydroxybutyrylation, where beta hydroxybutyrate can interact directly with the histones to activate different genes. And we started looking at this in the context of something called Kabuki syndrome. We had the Kabuki syndrome mouse model. But I'm convinced that these metabolites, especially ones that are robustly elevated with a ketogenic diet, have epigenetic effects, and it's probably not just beta hydroxybutyrate. We know that there's something called lactylation too. So lactate's very interesting, and was my original interest before ketones, actually. So that these metabolites that are changed profoundly by our diet, by fasting, by ketone supplementation, have very remarkable epigenetic effects in
So,
a positive way.
respectfully, let me just step some of this down for our viewers. And
Mhm.
one of the byproducts of getting into ketosis from a ketogenic diet is the production of something called beta hydroxybutyrate, which can be used as a fuel. But the question was, it also acts as a signaling molecule. Why is that important? What does it do? And what you described, one thing that you described that I think is really very important, is that it binds to certain cells in the immune system, receptors on certain cells that activate something called the NLRP3 inflammasome. Why is that important? Because that then causes genetic changes within the cell, these immune cells in the brain, for example, the microglial cell, that subsequently then will, when it's activated, will increase the production of damaging inflammatory chemicals called cytokines, but also influence the mitochondrial function
Mhm.
within that cell, the energy metabolism part of what goes on within that cell, and can help propel that otherwise helpful immune cell, the microglial cell, to becoming a harmful phenotype, M1 phenotype,
Mhm.
such that its metabolism is affected and its production of inflammatory cytokines is affected. And the worry there is that those inflammatory cytokines can then feed back and through the same pathway influence neighboring microglial cells and convert them from being friend to foe to becoming the evil twin, as it were. So basically, what we're saying then is that aside from the fuel aspect of ketones providing great fuel to produce energy, that they are producing, at least beta-hydroxybutyrate gets most of the attention, is acting as a signal molecule in terms of gene expression through modifying epigenetics, through what are called histone deacetylase activity, but
Mhm.
also through influencing through this inflammation pathway we just described, NLRP3 inflammasome, reduction of activation, influence the level of inflammation in the brain. And that's key. When we
Yeah.
recognize the role of inflammation in Alzheimer's and Parkinson's, multiple sclerosis, autism, that this is really what we're looking for. This is, pretty much the home run. Let me shift our conversation for a moment to something that you and I have been exploring, and that is the use of allulose. And
Mhm.
it's a new player for us. We've only been looking at it for a few years. So there's a lot of excitement about allulose. Tell us what this is and what you have found in your research on allulose.
Mhm. Yeah, allulose is really fascinating. So it's a rare sugar. It's found in nature, things like fig, and it's even in wheat, I think, in various
It
fruits.
is.
So it's a rare sugar that is an epimer of fructose. So very similar molecular structure, like on paper. It also uses the GLUT5 transporter to get into cells, and it's very low calorie. I think it's like zero point 0.2 to maybe zero point 0.4 calories per gram. So very low, essentially like no calorie. It's absorbed in the gut. It's excreted primarily, I think, in the urine. It is essentially non-glycemic, non-insulinogenic, compared to other has very minimal insulin response, very minimal, if at all, glycemic response, actually a lowering effect. Some studies coming out in animal models, and maybe I think there's about there's at least a half dozen RC randomized controlled trials for allulose. And we are, full disclosure, I guess, I have multiple medical students. We're working on a systematic review of natural sugar alternatives with erythritol, allulose, monk fruit, stevia. Allulose seems to shine for many different reasons. It seems to have functional effects, perhaps anti-inflammatory effects on the gut. It's generally recognized as safe by the FDA. Again, it is found in nature. If you take large amounts of it, which I did the very first time I tried allulose in 2014, I dumped a bunch into my coffee. It's about 70% as sweet as sugar. And if you put 30 grams in your coffee, on an empty stomach, you'll likely have some intestinal bloating and things depending. So I think it's good to start out with like maybe 5 grams. I can now tolerate 30 to 40 grams per day if the allulose is taken with food. But it also has some GLP-1 releasing effects, which is very interesting. And I think unlike other sweeteners out there. So it can, when I consume allulose, I wear a continuous glucose monitor. My glucose goes down, even if it's the allulose is in a chocolate bar, like an RX sugar bar. And I've measured insulin. It has essentially no insulin response. And I have not measured my own GLP-1, but there's research out there. Nature Communications showed that someone my size, taking an equivalent of 30 grams of allulose, they had like a 3 to 500% increase in GLP-1 secretion in a rodent model. And that has not been fully replicated, I think, in human studies, but there's research around that.
Very exciting. I mean, there's every month that goes by, there's another popular sweetener, it seems. And I think
Yeah.
lately we've seen some concern, at least from a cardiovascular risk perspective, with respect to erythritol,
Yeah.
a sugar alcohol. I think that, by and large, the more we can do to help people not cater to their sweet tooth, I think is a good thing. But I too, as you know, I'm using allulose. We've talked about this quite
Mm-hmm.
extensively, and I'm very happy to say that. And I'm taking in about 10 grams a day in the morning,
Mm-hmm.
and I think it's clear that it's having an effect on my continuous glucose monitor. There's no question about it.
Yeah.
Especially what I've noted is that there's generally, I find when I run that I get a little bump in my blood sugar as I'm starting my run, well, within the first 10 minutes or so. And I
Mm-hmm.
find that bump seems to be a little bit blunted in when I consume allulose ahead of time. Any thoughts?
I had the same response. I've even like posted about this on social media. if you engage in really intense exercise, and I think there's a threshold for heart rate stimulating, your sympathetic nervous system activation. And same can be said for exogenous ketones too. It seems to, for reasons I don't fully understand, I think it's decreasing hepatic gluconeogenesis and maybe decreasing hepatic glycogenolysis in a way, and probably perhaps enhancing glucose disposal in peripheral tissues, which is kind of maybe more exciting. So nonetheless, this has been reported by, I mean, you just reported it, I've reported it, and I think it's also in the literature that when, I think I forgot to mention, probably the most profound thing in the literature is that when you consume allulose with carbohydrates, with glucose, it significantly attenuates the glucose-induced, elevation when it's coupled with allulose. And allulose may be delaying gastric absorption. It may be, but even the area under the curve
Yeah.
is reduced, and that's remarkable. I don't know of any other sweetener that has that functional property.
Well, again, it's a great argument in favor of using a CGM.
Yeah. Yeah, you wouldn't know it. You never know it without that. So yeah, I think for the diabetic population, type 2 diabetes, type 1 diabetes, I know, I mean, allulose could be, especially if you have a sweet tooth, could be like a really important component. You can bake with it, you can cook with it, you can incorporate it into various things. And it can make, I'm working with the Moffitt Cancer Center because ketogenic diets can augment the adaptive immune system to perhaps make checkpoint inhibitors work better, these PD-1 inhibitors. So we're working, like, the big kind of pushback is the unpalatability of and the lack of not having sweet foods. But, with things like allulose, their dietitians and their metabolic kitchen that they just built, they can formulate foods and a whole array of different food products that could incorporate allulose and be, palatable to that person who's uninitiated to low carb or ketogenic. And
Well,
that's,
and
really important.
need we say more of Walter Longo? I mean, he's
Mm-hmm.
made it very clear as an adjunct to standard care,
Yep.
chemotherapy, radiation therapy, surgery, that challenging the body with a ketogenic diet goes a long way to enhancing outcome. And
Mm-hmm.
great work. Let me ask you as we close, what is the efficacy, the role, the utility of MCT oil in hopes of pushing people to a better metabolic state?
I love MCT oil, and I think it's like the poor man's ketone ester, right? Some of the ketone esters on the market, they're kind of derived from a 1,3-butanediol, which has some questionable things. I'm more inclined to use ketone electrolyte salts. But one thing that we observe is that when you take any exogenous ketone and couple it with MCT oil, it's the therapeutic effect of that is greatly augmented. And MCT oil alone by itself can elevate ketone levels in the blood independent of diet, meaning that you could be eating a standard diet, consume MCT oil, and you have about 20%. I think more if you're fat adapted and you're making lots of ketones. A significant percentage of that oil is converted to beta-hydroxybutyrate and gets into circulation.
Mm,
Also, MCT oil can cross the blood-brain barrier. So they can actually, unlike long-chain fatty acids, when you consume MCT, those fatty acids can directly get across the blood-brain barrier and into cells and neurons. In addition, they help your body to stimulate fat oxidation in the liver because they go directly to the liver via hepatic portal circulation. And it's almost like the liver is getting a big hit of fat, which is
mm.
could be uncomfortable for some people. So I think it's important to titrate it in slowly over time. But I think they are inexpensive, they're remarkably therapeutic, and I think they are a cornerstone fat for a ketogenic diet.
Dominic D'Agostino, we've covered the waterfront today. Thanks for spending time and sharing your wisdom. It's always great to see you.
Great seeing you, David. Yeah, thank you for having me on, and appreciate it.
You bet. We'll talk soon. Bye for now.
Thank you.
Well, I'm sure you all learned a lot today. I know I did. Dr. D'Agostino is a wealth of information. Again, the value of cutting back on simple carbohydrates, getting ourselves into a state of ketosis from time to time. We talked about fasting, intermittent fasting, all the potential inroads to better health, regaining insulin sensitivity, and really overall improving our metabolism, which is a central goal for us as it relates to our brains and even overall health. Thank you for joining us. I'm Dr. David Perlmutter. We'll be back soon on the Empowering Neurologist. Bye for now.